All right, for this edition of Billing Bites, we're going to talk about deductibles, copays, and coinsurances. So all three of these terms refer to an amount that the patient has to pay for their medical care, but they all mean something different. So a deductible is a specific amount that is paid each year before the insurance company starts paying. So this is the first dollars every year, and it resets. Most patients, their deductible starts on January 1st. However, there are a number of patients where the deductibles start at different times of the year. Me personally, mine starts on October 1st because it goes with the fiscal year of the federal government. So you want to make sure you know when your patient's deductibles restart. The deductible is a specific dollar amount. So let's say our patient has a $500 deductible. That means every time the patient seeks medical services, the first $500 the patient has to pay. Now, if that first time they go to the doctor in the year is expensive, and let's say it's over $500, then the patient's going to owe the $500 all at one time. However, let's say they go to the doctor just for a small exam, maybe they have an ear infection or something, and that visit might only cost $70. Then the patient's only going to owe the $70, and then the insurance company will keep track of that and say, okay, now you owe $430 more. Now, they're not going to pay the insurance company for that $70. They will owe the doctor. And then they go to a different doctor. Let's say they go to a foot specialist, and that visit is $150. The insurance company is going to say, okay, patient, you owe that $150, and now you have, I should have done something a little easier for the math, $430 down to $330, $280. Your deductible is now $280 that's left, okay? And you'll just kind of keep chipping away at it until you've paid the full $500. Once that $500 has been paid in full, then the insurance company starts paying. Do they pay 100%? Probably not. Your insurance policy is written explaining how it's covered. And if it's written to cover 100%, then you're good to go. Most patients, that's not the case. A cost sharing is a percentage. You'll see it written sometimes like this, that the patient has an 80-20 policy or a 90-10 policy. The first number is the percent the insurance company will pay, and the second number is the percent the patient owes. 80-20 is probably the most popular one. So the patient would then owe 20% of every service they have done for the rest of the year. Okay. The other way that we can calculate a patient's out-of-pocket is a copay, also known as a copayment. Copayments are not percentages. These are fixed dollar amounts, $5, $10. These don't change unless your policy is rewritten. So every time you go to the doctor, you owe $10, $10. So if I get a very expensive procedure done, I may still only owe that $10. That's really great. The insurance companies would prefer that I owe a percentage, because then every time I get something expensive, my cost out of my own pocket also increases. So if I get a procedure for $100, my 20% is $20. But if I get a procedure that's $1,000, my cost, my 20% is now $200. And so it makes me personally invested in the cost of my health care. It makes somebody think twice about pushing for expensive tests. I've had patients come into my office and was lifting something, or they were raking leaves or gardening, and they threw their back out, and they insist on an MRI right on day one. Well, that's not really medically necessary unless there's clinical reason for an MRI. You probably don't need one. But I've had patients insist that that's what they want, clearly that's a person who's not paying much money out of their pocket for that expensive test, because if they were paying several $100s, they might be a little more conservative in their treatment choices. All right, so that is deductibles, copays, and coinsurance.